Welcome to another edition of Diaz Corner. My name is Akos. Today's edition is sponsored by Lex Kidney Care, and welcome to my lovely kitchen.
Lex Kidney Care, Lexington's premier specialists in the field of kidney disease, offering expert treatment for kidney stones, hypertension, kidney failure, and more. Not just treating the symptoms, but managing all your kidney-related health issues. From prevention and medication to replacement therapy, Lex Kidney Care is here to help. Whether inpatient, outpatient, or dialysis care, our compassionate staff will coordinate and work with your providers. Call or visit us online today and start feeling better.
So the month of March is Kidney Health Month. So we want to place some emphasis on our kidney health. And we have the pleasure of having with us today our distinguished Dr. Kenneth Afenya of Lex Kidney Care.
Hello, Akos.
Doctor,
how are you?
Welcome.
Thank you.
Thank you so much. And it's so lovely to have you here again. I mean, there's so much that I always learn from you when I meet you. It's quite exciting. And so today, I know we're going to talk about kidney health, but I also know that you like Spanish omelet.
Yes.
So I thought it would be a good idea.
It actually reminds me of when your mother made it. It was
yes.
So nice.
Well, mine is going to be better than hers. So this is some type of, I'm trying to compete with her. So I'm going to try and make mine better than hers.
All right.
So Mama, if you're listening, my Spanish omelet is better than yours.
All right. So what do we have here as our ingredients?
So to make the Spanish omelet, I'll use about 5 eggs. So these are my spices with salt. And then I already got the potatoes ready. Okay. So what I did is I took about 4 medium-sized potatoes and then I diced them up.
Okay.
And then we'll use about 3 or 4 tablespoons of, I'm using avocado oil today. Okay. And then just some onions.
All right. So, all right, viewers, we have egg. And what's the name of this spice?
This is my secret spice.
Okay.
Don't try to give my secret out.
Ooh. And this one. Wow.
Chopped onions. Yes.
All right.
So, I have an apron there for you.
Okay. Thank you. Let me
doctor,
cover myself.
Let's start the Spanish omelet. First of all, what we do is we'll just warm up. Let's get this warm.
Okay.
And then we'll go ahead and saute our onions and potatoes.
All right.
I typically like to do the potatoes first.
Yeah.
And then let it get a little soft before I put in the onions. But I'm getting the pan. We'll get that pan ready. Let's put some oil in.
So the oil will go in first, right?
Correct. The oil goes in first.
What is going to be our next thing?
The next thing would be your potatoes.
Oh, okay. I have it backwards. I was thinking the onion will go in before.
No, I'll do it doesn't really matter how you want to do it. You can. At the end of the day, the most important thing is to get the vegetables as soft as you can before you put the eggs in.
Okay. So should I add?
Let's let the oil get hot a bit.
Okay.
But in the meantime, doctor, so I know you're a nephrologist. Mm-hmm. Can you tell our viewers who a nephrologist is? Okay.
So a nephrologist is a doctor who specializes in kidney care. So basically what we do is help you. One, the main thing is prevent kidney disease. And so that is the main goal of a nephrologist. And if for any reason it happens that you have kidney disease and you even end up on dialysis or you need a kidney transplant, the nephrologist will be available to help you.
Okay, so it seems like the kidney is a vital organ in our body. What role does the kidney actually play?
Yeah, so the kidney is very important because one, the kidney is responsible for cleaning the blood. So when you eat, like what you're coming to eat now, you have accumulation of minerals and sometimes waste products. Mm-hmm. So the kidney is actually responsible for removing all these waste products so they don't accumulate in your
blood.
Yeah.
So does it kind of like do a filtration of the blood?
Kind of. So that's one thing. It's mainly for filtration of the blood, like you said. Then, in addition to that, the kidney is also responsible for maintaining your body, what we call homeostasis, meaning that a balance of fluids, electrolytes, and chemicals, and things like that.
Wow.
Yeah.
Wow. So what are some of the things that cause kidney diseases? So let me try one and see.
Sure.
Well, we don't want it to get, yes, I think it's
so you add your
potatoes. Oh,
yeah.
I made a little
So whilst
splash.
you're doing that, some of the things that can cause kidney disease, the number one is diabetes, high blood pressure, and some what we call autoimmune diseases like lupus and other things can cause kidney disease. So those are the things you want to concentrate on when you go to visit your nephrologist.
So how would is visiting a nephrologist part of my normal health care, or I have to see my general practitioner or my primary care physician and they would notice something in my body and refer me to you?
Yes, so that's a very good question, because most of the time people will be thinking that you have to see, like we're talking here, you said, oh, maybe I have a kidney disease and I need to see a nephrologist. No, it doesn't happen that way.
Okay.
Basically, you'll be seen by your GP, who is your general practitioner.
Okay.
And they have a cutoff. So they'll take care of you until it gets to a point where they say, okay, now you have a stage 3 kidney disease.
Okay.
That's when they will refer you to see a nephrologist. So stage 1 and stage 2, they are able to take care of you at that stage.
Oh, so you come in when it's at stage 3?
Yes.
Okay, so
that is when what we call your GFR is less than 60.
Oh.
Okay. But take note, there are other reasons why your GP would refer you to a nephrologist.
Okay.
Sometimes you have kidney stone. Sometimes you have protein in your urine, or sometimes you have blood in your urine. All those things. And there's something we also, genetic condition called polycystic kidney disease. Your GFR will be greater than 60, but still your GP will refer you to go and see a nephrologist at that time.
Okay. So as we're talking about the kidney, you should be paying attention to your omelette as well.
Okay, so where are we now? So
we need
I stir it?
You sure can. And now we have to put in your onions and then put in some spices.
Okay.
So
the onion is the second thing going in now.
That is correct.
Okay.
And then let's put a little bit of your spices in here. We're not going to put it all. These spices don't have too much salt, so you can put a bit of salt in here.
Yeah. Okay.
And so now
I can stir all of it together.
Yes. Okay. And then we can lower it. You can turn the handle towards you.
Okay.
Make it easier.
Yeah.
And then we can go ahead and stir it.
Okay. Let me know if it's
once you stir it and it's all in together.
Right.
We'll lower it.
Okay.
So what we want to do is we want it to kind of fry, but kind of boil as well.
Okay.
I don't know if I'm making sense here.
Okay. So this is a Spanish omelette, right?
That is correct.
Okay. Spanish omelette. All right.
And so I've lowered it a bit.
Yeah. So is it okay?
Yes, it is okay.
All right.
And to prevent accidents, I just turn it so
there are
no accidents.
Okay.
Yes. So the kidney is very interesting. So you talked about kidney stones. How do those develop?
Yes.
Because I've heard stories that they're like stones that come out.
Yes.
You really is it really like a stone I find on the floor?
Kidney stone is actually something we call crystals.
Oh,
So what is happening is that we have calcium in our body,
okay.
and we also have something called phosphate, and we have oxalate. These are chemicals that
Mm,
the kidney is supposed to get rid of.
okay.
So what happened is that if your um, there's something called um, super saturation. I'm using a big word, but it just means that you have a high concentration of calcium and oxalate or
Uh-huh.
phosphate in your body.
Okay.
And sometimes that ends up the kidney is trying to filter these minerals.
Mm-hmm.
And so calcium will now bind to oxalate or bind to phosphate to form a
Okay.
crystal, and it's hard stone. Yes,
Oh,
you can actually feel that it's hard. And
wow.
when this ends up in your kidney, is the worst pain you can ever have. I
Wow.
hear it's even worse than childbirth. So I don't
I've,
know. That's good.
so I've really heard people talk about I had a kidney stone, and then some say they're able to pass it out in their urine. How
Yes.
does that happen?
Yes. So the size of the kidney stone would
Hmm.
determine if you're able to pass it or not. So a kidney stone that is less than 5 millimeters,
Okay.
you can easily pass. So let's assume that you go to the emergency room, they do a CAT scan on
Hmm.
you, and they find out the kidney stone is less than 5 millimeters.
Hmm.
They will actually ask you to go home, hydrate, and you have a high tendency to pass it. But once it's bigger
Hmm.
than 5 millimeters, that
Hmm.
you have to have some kind of intervention to remove it or break it into smaller pieces for you to be able to pass it. Mhm.
Wow.
Yeah.
So are you saying that I could have a kidney stone and drink a lot of water at home and pass it out in my urine even without knowing I had a kidney stone?
Right. Yes, that is possible. That is possible. Yeah,
Wow.
that is possible. And so, and that is why it's really important to hydrate, drink a lot of water. You
Okay.
have to drink a lot of water to prevent that super saturation that I talk about,
Hmm.
to prevent the crystal formation in your urine.
So how do you get a lot of calcium in your body to the extent that it will crystallize into a stone? Is it
Yeah.
because I'm taking a lot of calcium supplements, or am
Yes.
I eating
Yes.
food with too
So,
much calcium?
so that is very, 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 very important question. The
Okay.
reason being that
Uh-huh.
having a lot of calcium in your diet actually prevents kidney stone.
Oh,
Interesting,
very.
interesting,
Okay.
interesting.
So,
So this is what happened. You have when you have food, you have oxalate in the food,
okay.
and then you have calcium in the
Mm-hmm.
food. When oxalate and calcium combine in your GI tract, you're likely to it's likely to end up in number two.
Okay.
But if you have less calcium in your food,
Uh-huh.
your body absorbs it, and then the oxalate also gets into your body. That's
Oh,
where they form the stone.
oh, look at the
Yes, so
signs.
the main thing is one, eat more calcium food
Okay.
and less oxalate food.
Okay.
The more oxalate you have, the more oxalate gets into your system, and then the
Oh.
calcium now forms the calcium stone.
So
Yes,
what
yes.
what types of food have a lot of oxalate?
Green leafy vegetables, and yes, yes,
Oh.
right, right, has oxalate. And so those are the things you want to avoid. Eat less of that. But if you have more calcium in your food, the better.
Okay.
Now, then you want to also eat low sodium
Okay.
diet. Now, the reason for the low sodium is
Hmm.
because it will prevent excess calcium
Build
in
up.
your build up in your kidney
Hmm.
area. Right, right, right.
It's
Very, very
yes, it's
tricky
very
because
and
you
very
think
tricky.
that since you're forming calcium stone, if you eat more calcium,
Yes.
you will form stone.
Yes.
No, so it's more oxalate rather. And so
Okay.
more calcium, then it binds and then you can get rid of it.
So are there people who have certain conditions where they can't eat a lot of leafy green foods?
So there are some genetic abnormalities
Okay.
that can lead to excess oxalate in your body.
Okay.
So those that sometimes we can do some tests to find out if you have genetic predisposition to having high oxalate.
And
Yes.
with that test that you just talked about, is that something that your primary care physician or your general practitioner would go ahead and put an order in for, or do they have to be referred to you as a nephrologist to do that?
Under normal circumstances, if you don't have kidney stones,
Okay.
this is not something we're going to be trying to do. We don't do it in the general population.
Okay.
So for somebody who, and then there are different kinds of stones.
Okay.
The calcium oxalate stone is an example of what I said. You also have uric acid stone, we have cystine stone, and then we have also a stone called the struvite stones.
Got you.
Those ones. So you have to know specifically if the person has calcium oxalate stone. And if the person does, then you send for the genetic test to show if the person has a high tendency to have high oxalate in the body.
Okay. So is kidney stones a disease that you get like just once in your lifetime, or are there people who keep on having repeat episodes of kidney stones?
Yes, yes. There are some people who have high tendency to form stones. They will have it now, or sometimes there's something we call stone bedding. That's how we determine how much stone are you forming per year or 6 months. There are some people who have recurrent episodes of stone formation. Very, very common.
Wow.
Yeah, very, very common. Yeah. And so that, if you, the thing is to work with your nephrologist. And if you work with your nephrologist, then there's a way we are able to find out how much calcium do you have in your urine.
Okay.
And there's also something called citrate.
Okay.
Citrate that you have in citric acid, like citric acid you have in your food, like lemon, and all that has citrate in it.
Okay.
Citrate actually, you remember I said calcium will bind to oxalate, right?
Correct.
Citrate actually prevents that binding together. So if you have high citrate in your system, you have less tendency to form stones.
Oh, so so is it a
lemonade is good.
So if I wake up in the morning and I because sometimes I just put like, if I remember, I put some lemon in warm water and drink it before I eat anything.
That is good. That will prevent stones. So, in fact, to the extent that if you have a tendency to form stone, we give you a medicine called potassium citrate.
Oh.
So some of our stone formers, we actually give them potassium citrate to prevent stone formation. So that's really important.
So let's get back to your potatoes. They should be like they're like mashed. They should look like they're like mashed potatoes.
Right.
So you mash it a little bit so it gets kind of nice and soft.
So can I take over now?
Please.
So I'll pull this one here.
Yes, sir.
So I should mash it, right?
Yeah, you see if it's like getting soft.
Yeah.
I like to do that so that I know that it's all cooked, and then I don't have like uncooked potatoes in my omelet.
So here we go. All right, I think I'm done now.
So now let's get to the eggs.
Yeah, let's push this one here.
Okay.
Prevention. Okay.
So with your eggs, we're going to so we have 1, 2, 3, 4, 6 eggs.
6 eggs. Okay.
Okay. So yes, that's your
one. Okay. All right. Okay, number 2.
Yes.
Then we go to number 3. And then we go to number 4.
Number 4 is proving difficult.
Yeah. Number 5.
And there is your 6th egg.
All right.
So now you can go ahead and whisk your eggs. You just have to,
Okay. I turn it that way. All right. Let me know if it's okay. Uniform, right?
Yes.
Okay. I think I got it.
Yes, you're doing a good job. By the time you leave here, you should be a master chef of making Spanish eggs, and the
Yeah.
next thing I'll know is you'll be speaking Spanish.
I got it. A little bit here.
So
All
let's
right.
see. I'm
Okay.
beginning to feel like we don't have enough eggs.
Want to add one or two?
Let's go ahead. So what typically after you've done that, what you want to do is to take this off the fire,
Okay.
and you let it cool down a little bit.
All right.
So we'll let it cool down.
Mm-hmm.
And then after we've let it cool down,
Yeah.
we will go ahead and pour that in the mixture of the eggs.
Oh, we're gonna pour this in here.
That's why we let it cool down a little bit.
Okay.
Because once you let it cool, if you put it in immediately when it's too hot, it might start cooking the eggs immediately.
Okay.
So you let it cool a little bit
before,
and then put it in.
Okay. How did all
after that?
I thought we were gonna pour the egg on it. Okay.
Oh, that makes me know that when my mom was making it, she didn't pay attention.
I wasn't paying attention.
No, so you didn't really see exactly what was done. So now my way is going to be the only way.
Okay. So here to here.
Yes.
All right.
So as those eggs are cooling down,
yeah,
what is the relationship between diabetes and the kidney?
So actually, diabetes is a completely different disease entity.
Okay.
The only the basic relationship that you can say is that is the number one cause of kidney disease.
Oh.
So if you have diabetes, then you can develop kidney disease because there are small vessels that are involved in the filtration system.
Gotcha.
So those vessels are affected by diabetes, and then your kidney function will decrease. Yes.
So kidney disease is could be a byproduct of diabetes.
Exactly. The same way hypertension can be a byproduct of diabetes, the same way high cholesterol can be a byproduct of diabetes.
Wow.
Yes.
So we need to like really be careful
about diabetes. Number one. So but the good thing is that's what I keep telling people. You have diabetes. If you don't take care of it, it's going to harm you from head to toe. It can give you stroke, blindness, heart disease. It can even affect your intestine. It can lead to amputation of your limbs. But if you take good care of diabetes, then the tendency to develop those things would decrease.
Okay.
Yes.
So with this month being kidney
awareness
month, is Lex Kidney doing anything special?
Lex Kidney has been involved in like visiting some TV stations, trying to create the awareness, and then local awareness as well. Because a lot of people, would not understand kidney disease until it happens to them or a family member before they will know, they have to now take it serious. Yeah.
Now let's check your eggs to see
where we are.
Yes, so
we know that. Let me take this thing out.
Yes. So typically, because I'm trying to be nice because we're doing
Let me send this to the sink.
Oh, I'm so sorry.
No problem. Okay, so go ahead.
So we just put that in here.
Yeah. Okay.
And
here we go.
You can mix it up whilst I clean this because we're going to use the same pot again.
Yeah. So you just keep stirring at it until it becomes uniform, right?
That is correct.
Okay.
And then I went ahead and turned. Had the eggs were just right.
Okay, good.
Okay, so now you have a uniform mixture, and so what we will do now is you'll pour that into the.
Ooh, that one I'll let you do that.
We'll let it heat up a little bit.
Okay.
And then what we're going to do is to pour
Yeah.
this.
Should I hold the?
No.
Oh, you're fine.
Yes.
Ooh, it's gonna be very nice.
Yes. So we have that in there.
Okay.
And
Yeah.
I would just put that
Yeah.
in, and we'll just wash the dishes later on.
Okay. Are we almost done?
I was just trying to. We have to let it cook a little bit.
Okay.
And I typically, what I do is I cook the bottom part.
Okay.
And then afterwards, I'll put it in the oven to broil the top part.
Oh.
Many a times, what most people will do is they will get a plate and tilt it over. But I just like to do things the easy way.
Okay, I get what you're saying.
Yes.
So like you let the bottom cook and then you turn it over so that this
just exactly how my mom was doing it.
Okay, but then if you put it in the oven, this will cook first and then
they
the
will broil
oven would take care of that one. Okay, got it.
So typically what we do is we'll just leave it on here for maybe 5 minutes.
Okay.
I put it on a little bit low heat because you don't want it to burn. You just want it to nicely cook and nicely brown. And then we'll be enjoying some Spanish omelette in a moment.
All right. Good.
So today you've actually brought a lot of awareness. So with this, me hearing from you today that a lot of all these little diseases that we hear about are byproducts of diabetes.
Yes.
How would you encourage people to prevent diabetes? And I mean, sometimes I hear people say they were born with diabetes, and I hear other people say that as they grow, they get diabetes.
So that's the thing. Diabetes is actually, like, if I try to explain it, you have what we call the type 1.
Okay.
And then we have the type 2.
Okay.
Diabetes is just because you have insulin that one, either you're not able to produce insulin, or two, that the insulin that you have is defective and not working.
Oh, wow.
So if you are not able to produce insulin at all, then we say you have type 1.
Oh. So those are the ones who they're born with that.
Exactly. They are born with that.
Okay.
Now you can also have a situation where the insulin is produced from the gland called the pancreas.
Okay.
Sometimes you can have a disease of the pancreas, like a viral infection or something that affects your pancreas, and now you cannot produce insulin.
Oh, no.
And then even though you have type 1 and type 2, you can have a spectrum of the degree of insulin deficiency that you have.
Oh, wow.
Right.
Wow.
So if you have type 1 and type 2, you can be like midway or have 30 degrees of deficiency.
Okay.
So you have those spectrum. Now, and so you can either be born with it or as you grow, you develop it because something happened and your insulin is not working as it should.
Oh, so type 2 is the one that can be reversed?
Not necessarily. You can't necessarily reverse it. You can do something about it so that the effect of it on you is reduced. So for instance, if you take insulin or you take medicine, then the effect of the diabetes on you will be reduced.
Gotcha.
Right.
So when they say that a person is pre-diabetic,
yes,
is that where it can be reversed?
That's when you can. So once a diabetic, you're diabetic, so you can control it. You can control it, meaning that even though I'm diabetic, I'm taking medicine or I'm exercising, I'm eating right and keeping my what we call the A1C below 7. So I can say I'm diabetic, but it's controlled.
So it's a pre-diabetic diabetic?
That is a phenomenon we're trying to get away from.
Because I always hear
it used to be common that we said
I always hear
diabetic. It's just a phenomenon.
I always hear that
because remember we said that it's a spectrum of disease, right?
Okay.
Where you're not full blown. So we say, hey, be careful.
Okay.
Let's say blood sugar, initially blood sugar of 126. Above that is what we use, like fasting blood sugar.
Okay.
Now we've reduced it to 110. Now, if for instance 110 is the goal, and you're doing 115, 110, and hovering around that area, even though you're not full blown, we say, hey, you're getting close to, or let's say, for instance, your A1C is supposed to be less than 6.1, and you are 6.5. We can label you as pre. You're getting close to something. Yes,
okay,
yes.
so
and that's the phenomena that came about, the pre-diabetic thing. That's
because it seems like everybody around here is
pre-diabetic. Yes. It means that your numbers are approaching being a full-blown diabetic. So that's how.
At that point, what can be done?
Yes. So that's when, if you do diet, portion control, a lot of exercising, checking all your parameters, making sure that you're eating right, doing exercise, and those things can prevent you from becoming a full-blown diabetic.
Got you.
Yes.
Okay. I don't know. This omelette is yours. You are making the omelette, so
we are almost there, right?
We are almost there, but let me turn on the broil on the oven.
Okay.
And what we will do is we'll put this. Let's do medium. Oh, there's no medium. It's either low or high. And what we'll do is we'll put this in there.
Okay.
And we'll leave it there for about 5 minutes.
5 minutes.
So typically, because I don't want the heat to.
Yeah.
It's already getting hot, so I like to put cold water on top of the.
Okay.
So it takes away some of the heat from there.
Okay. All right.
Yes. Well, doctor, there's a lot to learn about our health. There's a lot to learn about kidney. And it seems like, as I listen to you, it's so fascinating how this organ helps with that organ. And I just really want to go and do some research on diabetes.
Yes,
I have a passion for diabetes.
Yes.
I'm trying to write a paper on how having reliable internet access can help improve outcomes in diabetics. Yeah. So, I mean, it seems like with the pre-diabetes, exercising, knowing what diets, what to eat would help. So, at this point, is it advisable to have a nutritionist help you with the diet?
Yes, a nutritionist will play a key role. One, to prevent you becoming a full-blown diabetic.
Okay.
And even if you're diabetic, being in touch with a nutritionist, portion control, showing you what to eat and what not to eat at what time. It's very important to help you prevent all the complications that you can get from diabetes.
So the time we eat also can affect our system. I didn't realize that. Is that why I'm hearing a lot of people say, like, I'm doing intermittent fasting?
Yeah.
And I hear a lot of people say after 4 o'clock I don't eat.
So the timing also. So for instance, you have to so let's say you have bedtime, then you eat heavy, or you say, okay, as for me, I eat once a day, but then you eat a lot chunk at the same time. That is not a healthy way of eating.
Oh.
So what I tell my patient is, your body needs nutrition to thrive.
Mm-hmm.
Your immune system, everything depends on nutrition.
Okay.
Right? So if you eat a chunk in the evening
Mm-hmm.
and then it absorbs, that's all you have. And then all the rest will end up in number 2.
Okay.
But since your body needs it the whole day, you eat a little here, the body gets what it needs for that period. You eat a little here, the body needs for that period. You eat a little here. It's better than just waiting and eating a chunk here. Then here, your body is starving and struggling to perform. Then here, it's doing okay, but all of it ends up there. So it's better to have a balanced breakfast. Balance, make sure everything in it. You have a little bit of protein, a little bit of orange juice, a little bit of fat, a little bit of carbohydrate.
Got you.
And then the same thing here, the same thing here. So anytime you take your breakfast and you're about to eat, ask yourself, is it balanced?
Okay.
Is it balanced? Do I have protein in it? Do I have some orange juice in it? Do I have a little bit of fat in it? Fat, even though we don't like fat, your body needs it. So you give it a little, not too much.
Okay.
Because if you give it too much, then you form a lot of cholesterol, and if you form plaques, you can have heart attack. That's why I say low-fat diet.
Okay.
It doesn't mean no-fat diet.
It says low-fat.
Yeah,
low-fat diet.
Because you need fat to make your skin, the hair, all those things.
Oh.
That's how you put it. Cholesterol is needed for the skin.
Okay.
And all the cells, the membrane, all of that needs it. But what we are saying, it's not no fat, but low fat. Yes.
There's actually a lot to learn. There's really a lot to learn. So low fat, but so everything in moderation.
Everything in moderation, exactly.
So I am a culprit of like eating once a day. So I'm going to go ahead and take your advice and do 5 times a day, but smaller meals. So
3 should be enough.
So breakfast, snack, dinner, a lunch, dinner.
No.
Just breakfast, lunch, and dinner.
I think 3 should be enough.
Doctor, I wanted to do breakfast. Then I'll do it. So I wanted to do like a balanced breakfast.
Yes.
And then do like a
small
snack.
portion.
Yeah, and then do a snack.
Yes.
And then do lunch.
Yes.
And then do another snack before my dinner.
Yes.
So now you're saying, okay, so breakfast, lunch, dinner.
Right.
And you're saying that I should try and eat my dinner early in the evening before bedtime.
Yes.
About how many hours before bedtime?
At least 3 to 4 hours. Yes. The reason being, you want to sleep on empty stomach, and food takes about 4 hours to digest in your stomach.
Oh.
Yeah, 3 to 4 hours.
Okay. So if I go to bed at 8 p.m., I should make sure my last meal is about 4-ish. Okay.
Yeah.
Oh, there's a lot to learn. Oh, your omelette.
Almost ready.
Yes.
Good. Here we go. Wow.
We need to make sure it's cooked well inside.
Okay.
So I like to do the poke.
Yeah.
If it comes out clean.
Oh, if it comes out clean, then it means it's ready.
Yes.
Okay.
So let me get a flat plate.
Yeah.
So we can turn it over. You see, my way was simpler.
Yeah. So you don't have to turn it around.
It was simpler than. It was simpler than.
Here we go. You need help, or you okay? Got it.
And voila!
Oh my goodness!
There is
really
your Spanish omelette.
Here we go.
Now you can cut it up.
Yeah. Okay.
Here you are. It's yours.
Let's give it.
It's like a little birthday cake.
I know. Okay, this is just for trying, right?
Yes, but I got you a big plate to try on. So cut a big piece.
So here we go. I'm gonna take this one here. Okay, be careful.
This is nicely done inside.
Yeah, yeah. So
Can I try a piece, doctor?
yeah, go ahead.
Okay, thank you.
All right.
So I got another piece.
It's
So viewers,
really hot.
check doctor's Spanish omelet out. It really looks nice.
Yeah.
And we are just going to go ahead and enjoy our omelet.
Right, yeah.
But doctor, I just want to say a big thank you to you for your time today.
Thank you.
And thank you for educating us on kidney health, the general stuff. I have learned a lot about diabetes today.
Yeah.
It's always a pleasure to have you.
Thank you.
Viewers, thank you so much. The next edition, we'll have doctor come and we might make something else. But in the meantime, I'm going to say bye-bye to you all and enjoy my omelet with Dr. Afenya.
Thank you all.
This is really good.
Right. Really, really nice.